Well, hello. I'm here with Ali Butash. She is a new medical doctor at the St.Luke's facilities in Palmerton. And she has an extensive bio, and I would take up the whole interview if I read her bio because it's pages and pages and pages. But as John Nespoli would say, he's the president of St. Luke's Carbon Campus. We're very fortunate to have her. Oh. And those are the exact words out of his mouth. She is a general surgeon with a fellowship in surgical oncology. So I'm going to ask you a few questions,
Sure.
Dr. Butash. Talk about surgical oncology as a unique medical specialty.
Sure. So surgical oncology is a specialty of general surgery, so it's broad, and we spend 2 years training in cancers all over the body, and that includes soft tissue cancers like melanoma or sarcoma, breast cancers. It also includes endocrine cancers like thyroid, parathyroid, adrenal gland, and then a lot of gastrointestinal cancers like stomach cancer, esophageal cancer, pancreas and liver, and then as well as colorectal. So it's a very broad training for 2 years. But the unique thing about it, I think, is it helps surgeons have a multidisciplinary care focus because, as you know, cancer is usually managed by a full team of providers, not just surgeons. And some patients need lots of different types of treatment and others need just one or two things done. But it's basically a whole team approach to each of the cancers where a lot of specialists review the case and figure out the right series of events for the patient. So we learn a lot about cancer management as well as coordination of care for the patients. So it's not just about the operations, it's also about the overall cancer care and follow-up for the patient. So it's a unique specialty.
It sounds that way, and it is a kind of a rare thing. And reading your bio, she was like the head of her class, and she everything.
You're very sweet.
Well, like I said, it would take me the whole interview to read it. It's very lengthy. Cancer care and COVID, the gray areas.
So we did as much as we could to reduce the risk in terms of planning. We tested all the patients before coming into the hospital, but it was a definite case-by-case thing, and I think the hospital continued working up and treating cancers to the best of their ability while also trying to keep the patient's risk low. They did limit visitors, limit family members at appointments. That was really hard for patients, but we tried to use the virtual environment to overcome that in terms of getting everybody on the same team. And I think one really good thing that came out of the pandemic with cancer care is the tumor boards, which is when the different specialists all meet to talk about the patients. We used to do all of that in person, and now there's sort of a virtual meeting that I think has allowed more people to get involved and shown us that cancer patients can benefit from that. Even if they can't be on site in person, their case can still be reviewed by all the specialists without having to wait for the pandemic to end in order to benefit from that. So
one of the questions was the team approach for building success, and I think that is an example of a team approach. And of course, virtual became a very popular word in 2020, and so it has been emphasized in so many different ways, and it's great that it also included the medical field. So, well, just in reading your bio, I saw that you played softball at Lehigh University. Well, probably in high school too.
That's right.
So tell us a little bit about your personal self.
Sure. So, huge sports fan. Growing up, played a lot of different sports, but started taking softball very seriously in middle school and high school, and was lucky enough to play at the Division I level at Lehigh University. Had a wonderful coach, a wonderful team of players that stayed very close, and we competed highly at the national level. It was a great experience, but my time at Lehigh was monumental in terms of solidifying my interest in medicine. There was a St. Luke shadowing program actually in 2005. That was when St. Luke's had only 3 or 4 hospital sites, and I was able to shadow at the Bethlehem site about 20 hours a week as part of a course at Lehigh where we would present interesting patients to each other and write about them. So this was a very key experience for me to be sure I wanted to go to medical school, and that's when I started planning the road after Lehigh, which, as you mentioned, I went to Jefferson for medical school after that. The training path in surgery took me out and about in the northeast portion of the country. So, I know I speak for my husband and myself that we're thrilled to be back in the Pennsylvania area as local people who grew up here. I grew up in Langhorne, Bucks County, and my husband is from Scranton. So we were thrilled to be able to take our training and bring it back to Pennsylvania and kind of,
Now kind of in the middle at St. Luke's Carbon.
It's
How about
exciting.
that?
Yeah, it's exciting. Kind of close. Our families are in Scranton and Philadelphia area, and
right.
this allows us to kind of, get closer to family, as well as, start a practice here in a community that can benefit from this new St. Luke's Carbon Hospital, bringing all the care into their community. So it's a real honor to be here.
It is. It's so great to meet you. It's also great that we have such specialized doctors in our area now, and it's just nothing but great news from St. Luke's. And it's not that I'm just playing on St. Luke's. I mean, there's other hospitals too, but St. Luke's really has state-of-the-art things going on in their new hospital, which I hope everybody gets to see. And they're bringing in all these top-notch specialty doctors, which again is so favorable for our area, and that we don't have to travel to Philadelphia or whatever to go to a hospital, that we have it right here in our backyard.
Yeah, it's wonderful. Very excited to see how everything evolves, and I think I know the future in cancer care here is sort of still, the story is still being told, so it's going to be exciting to see how they can build it at the new hospital.